I was planning on getting out there and helping in December, but because my graduation was delayed, they don't have that new batch of nurses.
Nursing student Ali Anchuk will graduate in May, 5 months later than expected, because the coronavirus has impacted the capacity for hospitals and nursing homes to train students.
When the pandemic hit, we were about to go to clinicals for that semester, and all the local hospitals shut things down, so we weren't able to go.
Students are required to do in-person clinicals, real-world experience with veteran nurses and actual patients.
The entire pipeline of nursing education is impacted when hospitals say we can't take students.
California State University East Bay canceled nursing admissions for this spring and fall, making room for former students to catch up with their clinicals safely.
When nurses are working with students, that is time taken away from patients. Of course, it's educating the next generation, but when we have a crisis like we have now with the pandemic, we also know that PPE is running low. So can we ethically have students in clinical placements when they're not protected?
Some schools are partially substituting in-person clinicals virtually or in simulations so students can graduate on time. But some students don't feel as comfortable with this.
It's definitely scary, but I would say that I'm lucky that this last semester is heavily clinically dependent, and luckily when we graduate, nursing, your first nursing job is considered a residency.
Not all nursing schools have delayed graduations or closed admissions, but one thing is clear: the coronavirus has increased the demand for nurses, and we're not keeping up. Even before the pandemic hit, the American Academic Colleges of Nursing predicted 16 states will experience nursing shortages in 2025. Factors include an aging baby boomer population, high turnover rates, and a lack of nursing educators.
I'm going to retire in June. I'm 70 years old. And we have a lot of nursing faculty who are hanging in there, continuing to teach, simply because there isn't a doctorally prepared faculty member available to take their place.
A lack of nurses coming into the workforce could mean lower nurse-to-patient care ratios, which can decrease quality care and lead to worker burnout. For Newsy, I'm Kat Sandoval.